Australian women, welcome to your full body health check. This is Well, I'm Claire Murphy, and today we're heading into the consultation room to answer all your burning questions. Maybe literally.
And I'm Dr. Mariam, GP and an unapologetic women's health advocate.
Look, we've been doing some quick consults, Mariam, up until this point, but now we're ignoring the fact that our gap payment's going to grow because we're going in for a longer appointment today.
Yep.
We've sorted through all the queries that have been sent in and picked out a cheeky handful of some that are really interesting. But first, I would like to introduce to everybody today's special guest. Welcome to your pelvis. Now this, honestly, making this show, I have come to realise that I do not know enough about my own body, especially of a woman in her 40s. I probably should have been across a lot of this stuff. So for starters, I was not actually aware that your ovaries aren't attached to the fallopian tubes. I presumed it was like some kind of closed system.
So yeah, they're close to each other but not directly attached, and there's that little suction just to kind of guide that egg down the fallopian tube, and hopefully it does get fertilized, and if it doesn't, then here comes your period.
Then here comes your period.
You know, I learnt something actually. It's quite interesting. So if one fallopian tube is missing or damaged, it's possible for the egg to go from the opposite ovary, travel across, and then go in. Yeah.
How does it know to do that?
I don't know.
Does a fallopian tube from the other side reach out its creepy little fingers and be like, come to me? That is wild. In case you're not aware, we are delving into the pelvis right now. The pelvic cavity, it's a space between your pelvic bones. And the way we differentiate between a male and a female pelvis is that ours is larger and wider. And I don't know what this means, pelvic inlet is rounder. What does that mean?
Yeah, so there are key differences between man and woman. We have a larger pelvis specifically for childbirth. Mm-hmm. So it's larger and wider, essentially, so that there's room for the baby. That's why we call them childbearing hips.
Yeah, I believe I have them.
The pelvic inlet is essentially this round, it's like a round shaped circle, and that's to accommodate the baby's head.
Right.
Yeah.
So where it drops down to right before you push it out.
And interestingly, your pelvis remains slightly wider than before pregnancy, so after you've had a baby, and that's thought to be due to the relaxation of the ligaments caused by a hormone called relaxin, also responsible for that pelvic pain that you get during pregnancy. If your pre-pregnancy pants don't fit, that's probably why.
It's definitely why.
Yeah.
My pants don't fit. Inside the pelvic bones, which of course they connect your legs to your spine, you'll find your bladder, your rectum, part of your descending colon, your uterus, your fallopian tubes, and your ovaries. Your pelvic floor is this wondrously complex group of muscles and ligaments that support your bowel and bladder and uterus, which is what we're doing when we follow social media accounts like Female Physio Co on Instagram. These guys have gone viral recently because she posts every day a different video of her giving out different pelvic floor exercises like this one.
Okay, I need you to stop scrolling and squeeze. Let's go. On, off, on, off, on, off, on, off. One more. On, off, turn it on, hold. 1, 2, 3, keep holding. 4, 5, keep breathing. 6, 7, 8, turn it off. 3 quick ones.
Mariam, what I want to know is, we're told all the time to do our pelvic floor exercises, but can you over-exercise your pelvic floor?
No, you can't definitely over-exercise. A strong pelvic floor is essential because it helps prevent incontinence, whether that's from your stools or from your urine, and prolapse, obviously, as well. And so it helps you control your bladder and bowel movements, when you really need to go to the toilet, but you're in the middle of a meeting and you've got to wait, or you're doing CPR and you can't really get off the chest and go to the toilet. So that's really important. And for people that do have incontinence issues, you'll get a regimen prescribed by a women's health physiotherapist. And essentially it's probably exercises a few times a day for a couple of months. And then essentially it's daily for the rest of your life. Sometimes my women's health physio post kids because I had a bit of incontinence issues, as you would expect post twins. They were big babies. They were both over 3 kilos.
You're not a very big person either, I can imagine.
And I had a vaginal delivery. Can you imagine? I know. Anyway, so she recommended, because like I was really like, you know, having twin babies and then trying to set aside time for those pelvic floor exercises is really hard. So she's like, every time you're washing the dishes, you're going to count to 3, squeeze. And then every time you're driving and you're at a red light, and so just kind of incorporating them throughout the day. It's so important. And it's all muscle memory. So as soon as you stop doing them, they essentially get weakened again. So that daily exercise is really important.
Okay, get on it. Follow that social media account because that's the only reason I do it is because it pops up in my feed and I'm like, oh, God, okay,
Here we
right.
go.
I've got to do that again.
Squeeze those muscles.
What I really love too was there's a video that comes around like every now and then of where your organs go when you're pregnant because the pelvis does some serious rearranging during this time, right? So like your bladder gets all squished down to like a fraction of its former size, which is why you've got to wee every 5 minutes. And then like your intestines are essentially taking up no space anymore. They've just been like smushed off to the edges, which is wild. And then like you grow an entirely new organ in that space now too, because the placenta's like the only organ that is essentially disposable because you can just chuck it out and then grow an entirely new one.
Please do not eat your placenta.
Don't eat it.
Don't eat it.
Some people do though, right?
Yeah, some people shouldn't.
Why not? Is it bad to eat
It's
it?
like, it's full of waste. Like that's, like, you know, take it and plant it if you really kind of want to keep that connection. But please don't add it to your smoothie.
Okay, that's a lesson we should all learn. Don't maybe eat your placenta. Okay, Mariam, you're the doctor. Is there anything else that we should maybe know about our pelvises before we move on to question time today?
Well, just something. I'll share something that I learned with you not long ago. So the great thing about being a doctor is education is lifelong in medicine, and learning about new conditions is always, you know, coming to light. And I learnt about a new condition, which I think you're going to find quite interesting. It's a rare condition, and it's called persistent genital arousal disorder. I know, it sounds unusual, but it exists. PGAD. Yeah, so it exists. And women with this condition have this unwelcoming feeling of genital sexual arousal without desire and without genital stimulation.
Oh, so they could just be like walking down the street and
it hits. And it only improves when they orgasm, so it only improves briefly. It's actually distressing, can you imagine? And it has a significant impact on your quality of life because there's the feelings, obviously, they're unwanted and they're intrusive. You could be at work and you're like, oh my goodness.
Also, too, like when you're out in public, there's a lot of stigma around, you know, sexual arousal and desire and things. And if you're just like off in the corner orgasming every 5 minutes, like how tough would that be?
It's interesting. The body is bizarre.
All right. Now that we are better acquainted with our pelvises, do we say pelvises? Do we say pelvi?
Pelvis.
Pelvisi. We are opening up the floor to you to answer your questions. If you want to send us something, make sure you hit us up on email well@mamamia.com.au. So from endo and its relationship with HRT to whether you really can have a low pain tolerance. Next, we're getting into what you want to know.
The doctor will see you now just through here to consult room 1.
So the whole point of Well Mariam, right, is to get answers. So if you have a question you want to ask Dr. Mariam, or if there's something you need an expert in their field to tackle, I think I've told you enough times how to do this, but I'll do it again. Send us an email, well@mamamia.com.au. You know what you have to do now, right?
Thank you for waiting. How can I help you?
Oh, that was the sultriest intro we've had so far. Okay, let's start with a question from Ruth. She says, I spent 20 years being told I have a low pain threshold and to be grateful because it means you're a woman. Is the low pain threshold an actual thing?
I'm rolling my eyes. Irrespective of pain thresholds, if you experience pain and it's impacting your quality of life, it's significant.
Yeah.
Yeah.
Okay. Is it actually true? I love this. That if you live with other women and you're not on birth control, your periods will sync up.
So this is thought to be influenced by like smells that your body produces.
Pheromones?
Yeah.
Is that what we're doing?
Yeah.
Right.
Load of shit doesn't happen.
Great.
I am a real living example of that. 2 older sisters. My poor mum had to experience 3 daughters having their menstrual cycles not in sync. Yeah.
After my marriage ended, I started to have sex with new partners using condoms for the first time in a long time. I started to get chronic thrush. Is it a latex allergy and can I avoid it, or is it just a case of using the cream every time to clear it up?
First of all, can I say good on you for
Yes,
putting yourself
good on
out there.
you.
Go, girl.
Get out there.
So chronic thrush is a complex one. So in medicine, we love using the word multifactorial, and
fancy.
it applies to many things. So there could be many reasons why she has chronic thrush. It's possible that the latex from the condom is irritating and causing those symptoms. It can be giving her a vaginal dermatitis, which can mimic the symptoms of chronic thrush.
Also, it might not even be
No,
thrush. Okay.
no. So the only way you can really get that diagnosed is by seeing your GP. And in general, anything that changes the pH of the vaginal area can lead to thrush. So and interestingly, that can include period, semen, or scented body washes. So
Would that include like scented condoms?
yeah.
Okay.
So I would tell her to try a non-latex condom if possible. See if that makes a difference. If it's persisting, definitely see your GP to get some confirmation and treatment.
So Mariam said this one and she says, should you just get a marina or whatever suits your body to stop your periods and be free of pain and periods?
So if your pain or your periods are a cause of concern, you need to see a doctor. Why? Number one, we need to exclude underlying causes. We just don't want to be like, here's the Band-Aid solution, let's slap this on and see you later. It's really important that, we investigate. So if there's a potential cause, then we're kind of putting the treatment to where it's needed. And saying that, the IUD is a fantastic drug and it helps with heavy periods, it helps with painful periods. It's great for contraception. It's also great in that perimenopausal period. It provides that progesterone cover, and if you wanted HRT, you just add the estrogen on top. So it's fantastic. It's important though you see your doctor, exclude any underlying causes, and if you want it, you understand the risks versus the benefits. Every doctor should give you that advice so you can make an informed decision.
And you can leave it in for longer these days, right?
Yeah, so it depends. It depends on the use. So for contraception, it's been extended to 8 years, but if you're using it for painful, heavy periods or for menopausal therapy, 5 years.
Okay.
Yep.
From Brianna, is excision surgery with a specialist the gold standard of treatment and care for endo?
There is no gold standard treatment for endo because everyone's symptoms and experiences and impact on their life and the disease are so different, as in the previous episode.
As we found out, yeah.
We found with Dr. Harris. So it's definitely worthwhile seeing a specialist. And as we mentioned, seeing the specialists that have done that extra training in gynecology, that have that endometriosis training up their belt, to assess your symptoms, perform appropriate investigations if needed, and give you options for treatment. So treatment depends on so many things like your age, your reproductive wishes, methods that you've trialed previously, and your medical history. And if you do decide on surgery, those specialized gynecologists with that extra training will guide you through it. It's a multidisciplinary approach, and it's ensuring that you have a team of people around you with those qualifications to support you to make the right decisions.
So Therese is a lucky girl, Mariam, because she wrote in and said, I didn't have any pain as an indicator of endo and had no idea what it was until I was told post-surgery I had stage 4. Is that common?
So endometriosis, we know it's a complex disease. It presents differently in different patients and severity is not reflected by pain. So this means patients with early stage endo can have very significant pain symptoms. And similarly, individuals with stage 4 endometriosis can have little to no symptoms. So yeah, she's right.
She's right.
Yeah.
Okay. Raspberry leaf tea. I've heard so much about this over the years. Does it help period pain? I heard it does something to your uterus.
No scientific evidence for it, but if it's something you're really keen to try, by all means go for it. But I always recommend before you start a supplementation, see your doctor first, make sure that it's okay, that it's not going to interact with any other medications.
Should my wee smell? And what colour should it be? What if it's cloudy?
Smelly wee can be caused by a number of different things. So I'd say most cases it's probably due to dehydration. But like everything in medicine, there could definitely be other causes. I'd recommend drinking enough water until your urine becomes clear. And that's when you know you're drinking enough, and that's when you know you're well hydrated. If despite increasing your fluid intake, it's still a bit smelly, it's still a bit cloudy, definitely see your GP, especially if you're having other associated symptoms, whether that's pain or a burning sensation when you're passing urine. And yeah, they should be able to take a thorough history and examine that urine for you.
Okay, I love this question. It's an anonymous one. How are people avoiding yeast infections in summer? If my bikini's on for 10 minutes too long after being in the water, I have no hope.
Oh, goodness. Yeah. So unfortunately, in summer, the heat and humidity can increase the risk of yeast infections. We know yeast thrives in moist environments.
Moist. Great
moist,
word.
I know. So, so when you're coming out of the water in your swimwear, there's two things. So you've got that tight swimwear,
Like
moist
the lycra.
and you're still obviously wet from the water, so yeast will thrive in that environment. So to help reduce the risk, I'd suggest a few things. So change out of wet clothes as soon as possible to prevent that excess moisture. Choose breathable fabrics if possible. Opt for loose fitting clothes when possible, and try to keep the genital areas dry as possible. Alternatively, find a nudist beach. That might help.
Just set it all free, guys. Let the wind do its job.
It's also possible some people have predisposition to recurrent yeast infections. If you've done all the above and, you're not washing with soap, so we want soap-free cleansers, we're not inserting anything inside, then it might be worth visiting your doctor. They can offer you regular medication for a few months to try to get you on top of your yeast infection.
All right, we are smack bang in the middle of the big consult today. I don't know what our gap payment's going to be. We'll deal with that when we get to reception. So our next query is for all the herpes girlies. I get them on my face. It's not ideal, but we had a question come in that says, I was diagnosed with herpes a long time ago. I know there's no cure, but why so many people I know have it, and they all want to know why we can't get rid of it.
I know, it's frustrating, and I can assure you there's smart people out there working on a cure for herpes.
So they haven't just forgotten about us herpes gals. Okay.
But there are medications to keep it at bay. So if it's really impacting you, definitely see your doctor. You can start some antiviral therapy. And just know, medicine has come such a long way. HIV was once a lifetime sentence, and now many people can live long and full lives. So there is hope, and just, fingers crossed we get a cure soon.
And sometimes it's just having a slightly awkward conversation with new partners.
Yeah.
Does your labia change size as you reach menopause?
Interestingly, it does. So as you reach menopause, we know that estrogen drops, and it causes the labia to shrink and become thinner.
I just had a vision of my labia minora being like...
Yeah, essentially that's what happens. And the tissue also thins out, and this leads to loss of elasticity, and we call that vulvovaginal atrophy. And that's where things like vaginal estrogen is really helpful for symptoms like a dry vagina, pain with sex, and all those sorts of urogenital complaints. So if you're perimenopausal, menopausal, and suffering from those symptoms, definitely see your doctor for some vaginal estrogen.
And bye-bye labia minora.
Yeah.
Can diet and pelvic floor exercises fully fix urinary incontinence after having a baby, or do I need surgery? You are the prime candidate to answer this, seeing as you popped out a couple of boys.
Look, having a healthy diet and weight can certainly improve your symptoms. I would start by seeing a pelvic floor physiotherapist, doing the exercises. Obviously, it's not, one fits all. The approach is really going to be dependent on every patient and their experience. Sometimes people do really well with physiotherapy, and sometimes they don't, despite being really compliant with those exercises. There's room for medication for some people, and then when that doesn't work, we consider referral to gynecology for potential surgeries.
Can I ask a question about a pelvic floor physio?
Yeah.
How in there do they get?
Oh, it depends. They can do all sorts of things. It depends what your issue is, but they can get in there.
Okay, that's all I need to know. Can you get dermatitis on your vulva? How do you treat it? Can you use the same creams as you do on other parts of your body?
So you can get dermatitis anywhere, essentially, and it's often caused by irritants, and sometimes it can be part of a broader issue. For instance, if you've got things like eczema, I would start by making some small lifestyle changes, like using soap-free washes, like we've mentioned. Your vagina doesn't need to smell a certain way, and a lot of those products can disrupt the pH balance and cause problems, and they can also exacerbate dermatitis. Wear loose-fitting underwear, so people that do get dermatitis of the vulva, I tell them when you get home, just freeball, loose t-shirt and just let it breathe. And just make sure you're practicing general hygiene, like showering after the gym, and just wearing kind of loose-fitting clothes when you can. If the problem doesn't solve, you should see your doctor to exclude other potential causes. Sometimes it can be mistaken for other conditions like lichen sclerosis, which needs to be treated with stronger steroids. But essentially, yes, you can use steroids that you use on other parts of the body, but I would always be guided by a doctor in terms of the strength of the steroid and where it's being used.
Let's get into the tampon conversation. How often should you change your tampon, and is it safe to leave it in overnight or to use on a light flow day too, or should you transfer out for like a powder or liner?
So you obviously want to do what's comfortable for you. I generally recommend people to change their tampons 4 hourly and definitely don't leave it in for more than 8 hours. We know the longer you leave it in, it increases your risk of something called toxic shock syndrome. So put a reminder on your phone overnight. If you're not going to get up, then just put on some maxi pads or wear those underwears. Otherwise, on the lighter days, it's essentially what's comfortable for you, but put the alarm on your phone. Like we were speaking about earlier, lots of females double up with tampons and then they don't realize.
We had this conversation too. There is this advice going around on TikTok about double parking tampons, which is insanity because I don't even know how you coordinate double parking a tampon in the first place. But the fact that we sometimes forget that we have one in, like don't put two in at a time.
Please don't do that.
Insane.
Yeah. So the string is there for a reason. So always just make sure it's like hanging out and you're not pushing the tampon too far because I've removed lots of retained tampons.
And you said that they don't always keep their
it's
shape and stuff after a while.
It becomes like this just clotted tissue and it always has this pungent smell.
To the point where you can almost diagnose someone from a distance because you know that smell so well now, right?
4 times.
Wowzers. Also, I just, on those light flow days, I just had a vision of removing a tampon when you haven't got enough blood on it. Oh my God.
It's painful.
It is like scraping fire out. It is not nice. Okay, moving on with that visual image that we've just left for you. Clotting.
Yeah.
What is normal? I don't get a lot of clotting, but I've got girlfriends who explain I don't know how much information is too much information in this podcast, but she told me that she was in the shower one day and she stepped on one and it was like stepping on a bit of jelly, it was pretty substantial. But how much is too much?
So if you're passing a large amount of clots, that's definitely too much, especially if they're larger than a 50-cent piece and there's a frequent amount of them, and clots that occur with significant pain, or you've also got clots and heavy periods or painful periods, I definitely would recommend seeing your GP to exclude underlying causes. You could have a blood disorder. There could be a structural issue or a hormonal issue. So definitely see your doctor. And we also know that as a consequence of losing a lot of blood, many females, as we were speaking about earlier, get iron deficiency or iron deficiency anemia. And being tired isn't about being a woman. If you can fix that part of your life, it has a significant impact.
Yeah. Is it safe to put, and we have multiple things here, is it safe to put yogurt /food/objects in my vagina? And I'm just going to go out there on a limb and feel like maybe there's some fun, sexy play going on in this person's life and they're a bit concerned.
It's not my job to tell you what not to put into your vagina, but, whatever you insert into your vagina, there's always going to be risks associated with that. Even with penises, if it's not covered, there's always a risk of an STI, right? But if the question is asking whether yogurt is a healthy probiotic for the vagina, then I'd have to say there's no evidence for that. If you want to insert sex toys, that's all fine. Just make sure that you're washing them appropriately as well. And just, being aware that, whatever you insert in there, there's a possibility of an infection.
And just keep it clean, guys. Just give it a wash.
Not with soap, though.
Not with soap. No, we don't want to upset our pH. Yeah. We have talked about this off air this is crazy. It's like we're going back to Victorian England.
Yeah.
What is the most common STI these days?
So chlamydia still leads the way.
Chlamydia?
Chlamydia.
Go away. 'Cause
Chlamydia.
Doesn't she feel like a fancy lady,
Yeah,
chlamydia?
my name is Chlamydia.
Welcome to my fancy townhouse. My name is
Yes,
chlamydia.
Chlamydia.
Yes.
But there's so that is the most common STI. We see that particularly among young people aged 15 to 29. We're also seeing a rise in gonorrhea and syphilis. Yeah.
Like syphilis killed off kings of old,
Yeah,
right?
it's insane. Like I picked it up a few times and I thought I'd never see it in my medical career. And now I'm like, whoa, syphilis. I don't know if people are more complacent about their sexual health or if, it's so bizarre. Whenever I see females, I always speak about contraception. And a lot of them will be like, I am on contraception. But I'm like, that contraception only prevents you from getting pregnant. It doesn't protect you from an STI. And they're like, oh. Yeah. So
education is a gap somewhere.
There's a massive gap in that knowledge. And also, like, people are lazy. No one wants to put a rubber on it these days, which is... But if I have any advice for anyone out there, it's so easy to get an STI check, honestly. Every time you see the GP, I awkwardly always offer it. And I'm like, hey, when was the last time you got checked? Don't get offended. Like, do those checks. A lot of females don't have symptoms of an STI and they can have an STI. And we know that that can cause complications down the track as well. So if you're entering a new relationship, you've had unprotected sex with someone, and I would just advise you get it done.
Just get it checked.
Get it done.
Gals. Mariam and I are so very thankful that you've sent through all these incredible questions. We have learnt a lot more about how we work. And remember, again, if you want to send through a question, that email that I've said about 800 times already, but I'll say it again, well@mamamia.com.au. Remember, if you want to be anonymous, we've got a link in our show notes that explains how you can do that, as well as the link to leave a voice note if you prefer to, talk it out. I'm a talker-outer person, so I'm happy to say all the things all the time. Thank you, Mariam.
No worries.
We will be back for another consult in a few weeks' time, so make sure you get those questions rolling in. And the next time we hang out together, we are going to be checking in on our ADHD girlies. Yes. We have one on the team here.
That's so exciting.
So she will be tuning in quite specifically for this one. We're going to be finding out what is going on in our brains right now. Don't forget to sign up to the Well newsletter to make sure you don't miss any of the info as we go. All of that stuff is in the show notes. Bye, y'all.
Bye-bye.